I just wanted to welcome you all. We are so glad you're here. And today really is a bittersweet day. It is our last official consortium meeting for this 3-year project that we've worked on. So I can't even believe it's been 3 years. We have all been working together, and wow, time has flown in some ways, and in other ways, it's been a journey. So thank you. I want to ask if anybody has any announcements they want to make or reminders, if anything are going on in your community that you want us to know about. So I'll open it up real quick.
I will just share that we have a law enforcement summit coming up on September the 19th. It will be at the Jones Center. Uh, it's not just for law enforcement people. Quite honestly, I've wondered why we call it a law enforcement summit because we have as many other people. So would like to invite anyone who would like to attend.
Awesome.
We've got some incredible presenters. I think that you will really learn from, maybe some that you haven't heard.
Wonderful. That's
Wonderful.
exciting. You know, I have not, I'll personally be out of town on PTO that day. I know that because my PTO is coming up and I've been waiting a long time. But I'm curious, I don't know if you have engaged with the Eureka Springs law enforcement because at our open house, they had gotten a new police chief for the Eureka Springs department, and he was very interested in supporting mental health and substance use. So he might be a great person to engage.
Okay. I'm pretty certain we send it out to all
Oh,
the
good.
Northwest Arkansas law enforcement agencies. Do you recall what his name is?
Mm, not at the moment. I would have to look.
And Jenny, can I just send that to you and you could send it out to everybody, the flyer for the law enforcement? Okay.
Perfect. That's
Whoops, I
good
was
to know.
on mute. We can get it out to our contacts in Carroll County and Madison County, and
Great.
just kind of expand the reach there. And in Boone County, I know that's not your region, but we can send it out to everybody.
Yeah, we don't discriminate, so we don't care what region they come from.
That's awesome. That's great. Okay. Any other announcements, reminders, things happening in your community you'd like us to know about? If not, we'll move on because we've got some exciting things to talk about today. We're going to do a little bit of a recap of the work that we've done, and then we're going to share some outcomes with you. I just want to say it's really this work wouldn't have been possible without you. You guys have been amazing partners the past 3 years, and it really shows. We're starting to see not just on this project, but nationally, there's been a lot of efforts in trying to address the opioid epidemic, and I think we're starting to see a very small decline, but it's still a decline in overdose deaths, especially in 2022. So I'm excited about that. But really, just wanted to talk to you and take a walk down memory lane today. Um, Remind you of the area that we served. You could see the north central part of Arkansas was the focus. And then we had Sevier County, which we know we've got our partners, Dr. Lofton, and then Brittany and Lynette Gilmore are on here. And so we're grateful for their support. It really, though, started out, we did a needs assessment. And in that needs assessment, we really tried to be pretty encompassing of different people, different organizations that might be affected by opioid overdose. And so we did lots of interviews. And at that time, we, with our partners, started using the IMAT, which is a measurement tool that looks at current state and current work and values around substance use disorder. And then we were able to deliver that and come up with an outcome. So that was really great. We identified what are their critical needs. And then we started to expand the consortium. Next slide. Our target site areas were primary care. And so we did a lot of work around providing education to our primary care teams on opioid use disorder, because we often know in our rural areas it can be really challenging to access services. We know that in the areas we were working in, there wasn't a lot of access to treatment for opioid use disorder. I remember early on, I think in the needs assessment, when we were talking to possibly a drug court in one of the counties, and they said, gosh, there are very limited resources. Oftentimes we encourage people not to come back to the community because there's not a lot of resources to support them. And that was really, concerning. But one of the things that happened is primary care clinics have gotten a lot of education and resources, and they have expanded their awareness and willingness to address opioid use disorder. And we know we have a couple, well, not a couple, all 3 primary care clinics that we're working with are now really providing medication-assisted treatment. So they offer comprehensive care, they're coordinating care for the patients, and they're connecting them with peer recovery specialists, which is really exciting. Next slide. All right. So what we found out was it's important to anchor substance use disorder treatment services in primary care. We know that patients are going to their doctor, and they're going to their doctor for everything from a sore throat to substance use problems. And if we could screen and identify early, we can really provide important resources. We have done expert trainings. Everyone on the call knows I love expert screening, brief intervention, and referral to treatment. And that is an evidence-based practice that SAMHSA supports. And then following up with some case management to make sure health consumers are getting the care they need when they need it.
Oops, sorry.
Oh, we developed a vision. And it intersected, we wanted this focus not just to be on substance use, but we know that mental health and physical health are also key components, and really addressing the whole person and all their needs is absolutely essential. Next slide. Okay. Here we are. We were awarded in the fall of 2021. Again, here are the counties. We did add Madison County in 2022. We were excited. A result from the 2020 census was Madison County became a designated rural area. Prior to that, when we did our application, they were not. So that was great news. And hopefully Madison County will be able to partner with on more projects in the future. Next slide. But really, this project really focused on prevention, treatment, and recovery. And so HRSA had identified 15 core activities, excuse me. It's taken me almost all 3 years to learn about all of the 15 core activities. However, that was the main focus. Prevention. We've done a lot of prevention work. We're so excited. We've got, some of our prevention providers on today's call. It has been wonderful getting to know you all and getting to work hand in hand on some projects. We've been able to support you, whether it was having an exhibitor booth or helping provide speakers for conferences, as well as working on some initiatives that were happening in the specific regions over the past 3 years. Next slide. Treatment. We've done a lot of intense work with treatment providers. Training has been a key piece of this project. And so you have seen people on our webinars. You have, seen we've actually done our own conference. We've talked about multiple pathways of recovery. We've done a lot of education on peer recovery specialists. And then we did a lot of training really on medication assisted treatment. When we started the program, an X waiver was needed in order to prescribe some of these substances, such as buprenorphine. That X waiver has since been removed. But we're hearing, providers don't feel comfortable unless they get enough access to training. We've had subject matter experts that we've made available. And so that's been an essential part of this process has been education in the treatment realm. Next slide. I think it's probably going to be recovery.
Sorry.
No worries.
There we go.
And in the recovery area, we've had an opportunity early on. We connected with APART, which is Arkansas Peers Achieving Recovery Together. And it was really essential and instrumental for us to hear their voice. We know, that when we're working in the substance use space, it's important to have a message of nothing about us without us. And so really in this phase, we have incorporated our work with peer recovery specialists to make sure the projects, activities, and messaging that we worked on really had the input and expertise from our peers. We just recently, this past year, I won't steal anyone's thunder, but I know we did a lot of work around a peer recovery campaign. And so billboards are up, stickers, social media materials. And so I can't say thank you enough to our peer recovery specialists. You all have been instrumental, at least impacting how I think about recovery and educating me. So thank you. Next slide. And again, we just want to say thank you to all of our partners. Without you, this project wouldn't have. And so I just can't say thank you enough to each and every one of you. I hope you know this is not goodbye. We plan on continuing this work. I think all of us are now passionate and inspired. We've learned so much through this process, and we will be looking for future projects to continue the work in your communities. So with that, I'm going to turn it over to our next presenter. Oh, is it me, or do I have 2 more slides?
Oh, I'm happy to do this. I added this. We didn't assign these two because I added 10 minutes.
I'll go ahead, Jenny, real quick. I have to thank Jenny. As you know, Jenny has been our lead person who has been reaching out, working with you all on gathering the PIMS data. And so with this information that she has gathered, we have been able to see the effects of all your work. We've seen a 20.8% increase in screening. And when we started, it was hard. I remember, we talked about, well, how are we screening, and what screeners should we use? How will patients respond when we ask them the screening questions? So there was a lot of ambivalence about, is screening needed, and how would we get screening implemented into the workflow? But you could see after 3 years, we have had a 20.8% increase. So thank you. We've also had an increase in depression screening for people who are diagnosed with substance use disorders, 23.6%. Oftentimes we know there are co-occurring disorders, and so it's really important that we're screening not just for the substance use, but also screening for mental health issues, so we can provide the treatment that's absolutely the best treatment for the patient. And then maybe one of the most exciting pieces, here we are, we've seen a 62.2% increase in medication-assisted treatment. And so this is really huge for our rural communities. We know oftentimes people are living in an area where transportation's not available, and they can't drive an hour or an hour and a half to get the medication-assisted treatment that they need. And so we know now, as we're looking at substance use disorder as more of a chronic disease, if we're able to provide access to medication-assisted treatment, people are often able to be treated with medicine, stabilized. And we often hear from health consumers who are prescribed medicines that they get their life back. And so we are so grateful for you all this work. It's amazing. And we know HRSA is going to be excited with these numbers as well. And just so you know, we're going to highlight this work. We're gonna let people across the state know of all the positive things that have been happening with the screening, not just for SUD, depression, and then also the increase in medication-assisted treatment. So with that, I'll turn it over to the next. I think we have one more slide.
One more.
One more. In this, we've trained 2,586 people. Wow, that's a lot of people that have been trained through this project over the past 3 years. You probably have seen us across your communities on webinars. And so I just want to say thank you to you all for your constant support. Because you've talked to your communities and you let them know about these training opportunities. And I also have to say thank you to the ABIN team. This has been a lot of work to get all of these trainings out there. And you guys have been tireless, traveling the counties and making sure we were getting this important message out. So thank you all. And with that, I'll turn it over to the next speaker to share some more highlights.
All right. At this point, we're kind of just going to go down memory lane. And this is just highlights from each year. I'm covering our first year, 2021-22. Caitlin's going to talk about what we did in 2023, and Megan will talk about what we did in 2024. And really, it's thought about putting it to music because a lot of it is just in pictures and flyers and artifacts, if you will, of that remind us of what all we did, because it's been a whirlwind. So, I know that we've done, this was a drug take back day. Every year we've been somewhere. We've got 10 counties, so we can't be everywhere, but every year we go somewhere to support drug take back efforts in one of our counties. We've been doing health fairs, started doing health fairs in 2022. Here are Kim and Kyle Brewer at the Stone County Health Fair. I remember that. Caitlin and Kim presented at the Social Work Conference in March 2022. I think a lot on the planning project we were just completing at that time that led to this grant. And then there at the beginning, in summer of 2022, we had our first training on pregnancy, substance use disorders during pregnancy and postpartum. And Dr. Coker brought a really good presentation to our webinar group. In the fall, we started having a series of community conversations to just get people talking about opioid use disorder, about stigma, raising awareness, while also providing naloxone training. We did 3 trainings. I think the first was in Marshall, but that's the second slide. So here's the one in Huntsville. It was at the Presbyterian Church. We had the prevention providers. We had a panel discussion with representatives from prevention, treatment, and recovery. And Deb, this was before you were here. And so the prevention provider, Chris, I believe, was on our panel discussion at that time. Chris White. But then in Marshall, we had Kyle Evett here. He's the prevention provider in that region, and he was on the panel discussion. We had peers, treatment providers, and community members came, and we all talked about opioid use disorder and really what the needs are in the community. Kind of a continuation from the planning grant, but a little more focused on stigma and getting to action. And then here was, and we've got Brittany on the call here. Brittany was on this panel discussion and really instrumental in helping plan our community conversations down in Sevier County. That was an amazing turnout. We had a really great turnout, a lot of engagement. Is Deb still on? Yes, there she is. Deb, you may be interested in these. In that first year, we engaged some my previous coworkers and translated naloxone instructions into Marshallese and also into Spanish. And so these are resources that are available. If you need them, I can send them to you. I don't know if y'all are doing any naloxone trainings.
Yes, please send that to us. I'd love to have that. Thank you.
I will do it. I'll do it. And maybe,
Jenny,
we'd like to.
Oh, sorry. Can you email me that too? We have a huge population of Marshallese.
Sure.
Thank you.
You're welcome. I'm just making a note here. All right. And then let's see, we're still in 2021. So we had more webinars, more health fairs. Kim and Dr. Gibson started in on their SBIRT trainings. That was the first, part 1 was given in fall of 2022. I've helped Kyle Evett provide all of his counties. I provided a stigma training while they were providing naloxone training. And so that was a great partnership, and I was so happy to be able to support them. And then we had a wonderful speaker in fall of 2022, Dr. Xavier Amador. He presented on how to get someone help who doesn't think they're sick. It was really, really impactful, and we had a great turnout. So I believe that takes us into 2023. And if you thought 2021, 22 was busy, it just keeps going. So Caitlin, have fun. Just tell me next slide when you're ready.
Yeah. So we had a lot of stuff go on in 2023. Even looking over these slides just to make sure I was aware what was on it. It was like I kept going and going, and I was like, oh my goodness, I didn't realize we did so much in 2023. So, basically, very similar to Jenny, all of our stuff was very education based. We had our monthly webinars. We had a couple of speakers on that specifically with substance use disorder. The first one being screening, brief intervention, and referral to treatment, which is SBIRT, which was a 2-part series with Dr. Gibson and Kim. And they completed the second training on that early in January 2023. And then we invited Dr. Novak, who I think was with Baptist at the time, if she's not, I think she still is, but who is an infectious disease doctor, and she spoke on how to prevent infectious disease in the substance use disorder population and how we can do it from a primary care level. That is one, regardless on if it's a year, almost 2 years old, it is so worth going back and listening. She is a phenomenal teacher. And then we had several Narcan trainings. I think that your note up there means that we partnered with Kyle for these Narcan trainings, right? Okay, because that's a new note. So I just wanted to make sure I was reading it right. So we had several Narcan trainings in the first part of 2023 where we talked about stigma, and we were able to educate on Narcan and hand that out. So next slide. Moving on through the year, we, surprising, did more Narcan trainings. A couple of them were in, one was in Eureka Springs High School, another one was in the Van Buren County Library, and there's just a concentration on taking these trainings to where these people are at, right? We don't want to put it in a college setting that people can't get to, or during the day when it's not convenient for them. We really wanted to take it to the community, so that was a concentration with these Narcan training. And then a couple of our employees, Jenny and Misty, attended the Me Over Meth training in February and actually presented at it. I believe that's where you did your stigma training, right, Jenny?
Yes, I did
And
one
let me
there.
tell you, I don't know, I don't think we have a recording of that, but I had the privilege of looking over Jenny's slides, and she has a amazing stigma training. There are things in there. I've been a social worker since 2015, and I thought I knew what I needed to know about stigma, and I didn't. And so if we can ever get Jenny to present on that, I think that would be a real treat because she did wonderful at that. And then a couple of us on the team did a reverse site visit. That was a requirement for this grant. And we got to go to Atlanta, where we had, I think, 2 or 3 day conference, and learned about different creative ways to implement our objectives, and also how to overcome obstacles, because a grant isn't a grant without roadblocks. So that happens. But we also got to talk with other grantees and saw how similar states with a similar rural makeup were implementing this grant as well. So that was helpful. And then we have several resources on SDOH, but we did have a training in April on that subject. I can't see. Oh, that's Angie Walker and D Queen provided that social determinants of health training, and she talked about their clinic where they have a really unique integrated model, and SDOH is integrated into their treatment plans, and they do a lot of community resources like food and transportation and delivery of meds. So that is a very unique thing going on in Southwest Arkansas as well. So next slide. And then, of course, we want to mention in 2023 we had the very first behavioral health integration conference, and I did not look at my numbers beforehand, and I don't want to steal the thunder of 2024 because that was phenomenal. We had a great response to that, but 2023, with it being the first conference, we had great attendance there, and we got to engage several of our grant partners and ask them to speak about the efforts going on in their clinic related to this grant with implementing medication assisted treatment, and also if we were partners on another grant with them, or if they were using an MSW student, and how they married those two things together. So you can see down there Dr. Lofton, and we have a panel with several of our other colleagues that we've learned to, or rather developed a relationship with through other grants. So it was a very unique conference with 2 different tracks. One was on behavioral health integration, and then one was on substance use disorder. And we were able to have Casey speak about peer services in Arkansas as well. And down there at the bottom, you can see our team that put that on. So, and Misty's not on here, but Misty was the backbone of this conference and last year's conference. So she deserves all the kudos for putting that together.
There she is.
No, I mean, she's not on the call. Yeah, she escaped today. So next slide. This was an opportunity. We also gave an educational opportunity for sites to learn how they could become a National Health Service Corps site, and which could provide a significant amount of benefits to the employees there, and funding for the patients. And that training was provided by Tracy, who is with, I believe, is it the VA or is it the Public Health
She,
Service? Okay, okay, there
she,
she is.
yeah, with
Got
the
it.
National Health Service Corps.
Thank you. Mhm. Yeah, and that training is still available on our website as well. And that's one we really want people to know is out there, because this is knowledge that could be useful across the continuum. It doesn't matter when you learn about it, just as long as you learn about it. So I would definitely take some time, maybe pop that on while you're driving home, and just listen to how maybe some of these opportunities can help out your clinic or your organization. Next slide. Okay. Um, just moving on through the year, during the summer of last year, we invited Dr. Mancino, who is with UAMS, to speak on treating opioid use disorder in primary care, which is a big objective of this grant. I'm a huge fan of Dr. Mancino. I think he has done wonders for Arkansas and his expertise. So it was great to have him on. And then we also were able to host, as part of a series, another installment of SDOH to discuss sustainability and billing, which is one of the biggest things we are asked about when it comes to implementing SDOH into the primary care clinics, because you need to get paid for your time, right? So this is still extremely relevant, even as some of the codes are changing. I know there's been some changes made this year. It's still very relevant to go back and on our website and listen to that, because SDOH is not going to go away. It becomes an even bigger problem, especially with our economy. People are going to need more help as we go through these healthcare changes and the changes they're making to code. So down there, you can see Kim and Jenny went on their reverse site visit to Washington, D.C., I believe is where you were at, right, Jenny? Where
Yes.
they took, that conference, I had the privilege of going this year. That conference is intense. There is a lot of educational opportunities, and they really highlight grantees that are doing it well and have really good outcomes. So again, much like the Atlanta trip, we were able to talk with other grantees on a much bigger scope about how they are implementing some of this stuff. So, and then down here, you can see that we helped host the Whole Health Bash, and Jenny actually was not a part of that. Do you have a little bit more information on that, on what that was?
We didn't host. We participated. This was something that the community clinic, prevention region 1 put on, and Kim and I went. Everybody had tables that had kid friendly activities, and Kim and I helped kids make stress balls. So it was fun.
Nice.
And we gave out information. So we had well, I believe it was stress balls. Um, Something with balloons and rice. And
I think that's what that is. Yeah.
I think it was stressful.
I
That was
love that.
fun.
Some people will, I know that there's a trend going on right now of creating calm rooms in schools. And a lot of people will ask, what do kids have to be stressed about, right? Like they're not paying bills and they don't have adult worries. But in reality, they do. They really feed off of adult emotions. They have their own concerns going on at school. They have interpersonal relationships that they have to navigate even at a young age. So giving them an opportunity to make stress balls and give education to the parents. I mean, that's a big thing. I'm glad that you guys were there for that. Okay. Next slide. Okay, and we got to visit our friends down in Southwest Arkansas and provide Narcan training and distribution in June of last year. It was a free event, and we had a really good response to it. We had several of the health clinics in the area send their employees so they can learn how to do that and receive Narcan. And then we had a good response from law enforcement in the area, and we were able to supply several boxes to them as well. So that was I think that was one of the biggest things, is just making sure these areas that we're concentrating on are saturated with Narcan, right? As giving people the chance to engage in care when they're able to. We also attended, you can see a picture of me and Jenny there. We also attended the Senior Citizen Day in DeQueen that was downtown on the square. And that is um, just a half a day of people coming from all over the county and even neighboring counties to provide services to the senior citizen population in that area. All kinds of different organizations. Health screenings were done. You were able to talk with some of your healthcare providers. They were doing um, free lab services, your basic ones, and was really able to engage the community and just being aware of what healthcare opportunities are out there. And then we had, and I think I heard Brittany talk earlier. Brittany and her mom Lynette most graciously provided stigma training and Narcan training for us again while we were down there in June, and we are just so appreciative of them, and we know that they have a unique connection to that community, and they are often the boots on the ground people out there. So we appreciate all the work that you guys have done with us over the past couple of years, and know that you're doing good work. So that may be, is that my last one? Jenny, is that my last slide? No. Oh, here we go. The animated one. This one was fun. Okay. And then just to kind of wrap it up, we have a couple of educational things that we made throughout 2023. And I'm really proud of these, because this is something that's going to outlive the grant. This is something that you can continue to share for many years. And this is a flyer on xylazine. This is something I believe Misty made to provide education on just the new drug trends. So we know fentanyl is big in Arkansas. Xylazine is making its way into the state. It's not as big as a healthcare or health crisis as fentanyl, but I mean, as we know, as we have seen throughout history, these things continue to build on each other. So this is very important to have for your primary care providers or anyone in healthcare, so they know what to look for, because this particular drug causes really intense wounds that will not heal with normal protocols for some of these things. So it's really important to not only know what an overdose looks like for this, but also how to do some wound care. And then we've got some other things that Misty made, discussion about co-occurring disorders, which is the coexistence of mental health or mental illness and substance use disorder. And I will tell you, as a clinician, there's often not someone you will run across that does not have a co-occurring disorder. It usually comes hand in hand because somebody does not just pick up drugs one day because they were bored, right? They have stuff that they've gone through and they're trying to feel better. Another one of the initiatives that we did with this grant was we wanted to educate the 911 dispatchers and law enforcement on how to distribute Narcan and where our community boxes were at. So we provided a really simple, as you can see there, 1 through 6 instructional guide that we printed out in cards and laminated and provided to the county dispatchers for where we put the nalox boxes at. And this is just to help them be able to give instruction over the phone for Narcan. Another one of the objectives that we've talked about was peer support. We created this flyer so people can understand what peer support is, because we are still coming across healthcare professionals, people in the community that are not sure what peer support does. And we know it's a vital part of the healthcare team, so we wanted to make sure we got that out. And we put some contact numbers down at the bottom for Ashley and Josh. Helpful tips upon discharge was part of an objective for, yes, we will, Brittany. Part of an objective to connect inpatient law enforcement and then ambulatory services, because, and then in case anyone is being not discharged, but released from prison or jail, we know that it can be overwhelming for someone coming out of those facilities to figure out what they need to do. So this helpful tips upon discharge gives some suggestions on where to start so you can get services as fast as possible. And of course, again, one of the biggest objectives we have is busting stigma. And this is one of the flyers that Misty created. And you may have seen this circulating online. I know we ran an ad for it on Facebook, but just giving an explanation, a very simple explanation about what medication-assisted treatment is and what it is not. Really taking down that idea of you're just trading one thing for another, and explaining how it is helpful for someone, especially if they've been battling addiction for several years. I think I've got one more pop up. And we also did a concentration on substance misuse and suicide risk. We know in this population that suicide risk is higher because substances can decrease your impulse threshold, and you make more impulsive decisions when you're under the influence of something. So it's really important for us to provide education just to the community about the risk that's associated with substance use. It's not just overdose, it's not just infection, it's also their mental health as well. And that as clinicians and as primary care providers and care team members, we need to be aware and watching even closer for this population in case they are having a mental health crisis as well. And that is available on our website, and it's available on our Facebook as well. Go ahead. You're good. We provided these brochures that explains the SBIRT that was recently mentioned by Jenny and by me, the screening, brief intervention, and referral to treatment. We provide this education and it's a quick rundown of what it is and how to get in touch with us in case you want us to come in and educate your team on that. It's one of the gold standards for primary care. I'm trying to run this through this fast because I know Megan's I'm going fast as I can. Okay. Okay. And then a couple of more instances where we've been able to get out into the community and provide education. Our doTERRA bags, which is safe disposal of medications. The little reel here, which I love, shows multiple pictures of us being at hometown health coalitions, at health fairs. One of my interns there at the top left corner was at a health fair in DeQueen. And then we've got Ashley and Misty and Jenny down there at the bottom right corner. Some of these were also drug take back day. Just any opportunity we had to get out into the community and do some of this education, we were there. We also attended the drug summit that the Attorney General put on last year, which was great because we got to see how people are combating substance use disorder and in Arkansas, right in our hometown and in our home state. So that was nice to not only see that, but be able to talk with these organizations and ask, how can we help? Is there a way that we're able to supplement what you're doing? And then down there at the bottom left, one of the things that we did, I think, very well was install these nalox boxes, and that is very much due to Josh and Ashley and Megan's efforts. They worked very hard to make sure all of our target counties, except for one, we're working on one, have received a nalox box in their community. Many of them are placed in places that are either open 24/7 or are a community meeting place. Down there at the bottom, that was when we installed, and I believe in Harrison, if I'm remembering correctly. Is that the Harrison picture, Megan?
I think that's the jail that we installed, the sheriff's office.
The sheriff's office, yeah.
Mm-hmm.
I think so.
I can't remember what county it was. Maybe it was Harrison.
We've been all over the state. Doing this. And I know in Jasper, that was one of my favorite visits because the nalox boxes in the library there, and the staff were so inviting and really interested in providing the service to their community members. So. And then over there on the right, you see Dr. Schuler. His name's covered up a little bit, but that's Jim Schuler. He is an addiction medicine doctor. He's also an ER doctor in Colorado. And he has a two-part series that he did for us on the science and stigma of addiction. And his is very, very science heavy. He goes through the brain and discusses how addiction shows up in chemical imbalances and what it does to the rest of the brain and why our bodies react the way they do as we are getting addicted to a substance. It is phenomenal. Even if you are not a clinician, but you work in this career space and with this population, please go give it a listen. I have to listen a couple of times to really absorb everything he's saying, but it is so worth your time. Okay, next slide. Okay, now I'm going to hand it to Megan because she's got really good stuff.
All right, let's bring it on home with 2024. So I'm not going to hit every single photo because we are running out of time, but I will hit the highlights. I want to start off by highlighting the top left photo and the one right below that. That was the ribbon cutting and grand opening for the Eureka Springs ABIN office, which was a huge deal. And that community has been so welcoming and participated in everything that we put on there. So it was just a great opportunity for us. Then you'll see Misty, Josh, and Ashley dressed up there. That is the Region 3, I believe, prevention conference, and that was at the Ozark Folk Center, and they had a lot of fun. Everybody in our team loves an opportunity to dress up, so you can see that displayed here. It looks like they had a great time. The next one, Kim, I believe, was at a drug take back in Huntsville. Is that correct? Yes. So we, as mentioned earlier, we try to hit a different community for every drug take back each year. For our monthly webinar integrated peer recovery support specialist into healthcare. That's a big deal. I should know that one. Okay, so in February of 2024, we put on our day-long training to integrate peer support into healthcare. We had peers come from Divine Intervention and from Recovery Center of the Ozarks. And we also had, at the time, I believe 10 at the time, facilities that attended. And that program has continued. After the training, we did implementation, and we have 6 peer support specialists working in 9 different healthcare facilities and so there's primary care clinics, urgent care clinics, and then there's some emergency departments. So that was a great time and an awesome opportunity for us to get to implement peer support across the northern part of the state. And then that picture at the bottom is all of us after the training: myself, Misty, Dr. Martin, Kim, Jenny, and Sean McCowan. Next slide, please.
Oh, the day I got COVID.
The what? Jenny
the day I got COVID.
That's
there
right.
I was with COVID. I didn't even know it. All right.
Okay, so we continue with our monthly webinars. No, this is not the webinar. This is the Boston Mountain Medicated Assistant Treatment Program, which they implemented medicated assistant treatment through this grant. Is that correct? Am I correct?
They were implementing before.
Okay, they were implementing before, and then they shared their experience and what worked well through this one-day conference that was in January.
Yes, this was just a 1-hour presentation on their MAT program, on the benefits on MAT, kind of breaking the myths about MAT. And then Caitlin also gave a presentation that day on a very brief crisis intervention, kind of a teaser for the crisis intervention, the full day crisis intervention training she and Kim did in May.
Yes, April
or May.
April. Teamwork. Thank you, ladies.
We can't all be everywhere at once, so.
Yep. Okay. Now, for the third time, I'm going to say, part of our webinar series, monthly webinar series, this really is it. No, it's not. This is our conference. I can't get it together. Excuse me, guys. So this is our 2024 conference, and I do want to share that at this conference, we ended up with 202 in attendance, which was an amazing turnout. We had a great lineup of speakers and presenters. Everyone had really good feedback at the end of the conference. So we are excited about that and look forward to future conferences. You can see the whole team here in that first picture, and then to the right, Dr. Martin speaking. And is that Dr. Gibson at the bottom? I can't tell who that is.
In the blue, yeah.
In the blue, yep. And then Donald McDonald's the bottom left, who is a social worker and a peer specialist from a different state that came in. He's also a technical assistant for the HRSA grant. Okay. Then is the assessing and managing suicide risk one of the monthly webinars, I'm guessing here?
No, that was the all day deal that we did in April.
Can you speak to that one for me, please, Caitlin?
Yeah, so this was a training that we provided for free for those in the Carroll County area. Really, anyone can come. We actually had someone drive all the way from Conway, which we felt bad. We could have just picked her up on the way. But we had, I think, 6 people in attendance, and we spent 8 hours going over just the framework for managing and assessing suicide risk in primary care, specifically with those who are suffering from a substance use disorder, because as I said before, that increases the risk. And there's just different conversations you've got to have with patients that have this co-occurring illness. So we had a really good response to it. I think we're looking at doing another one. And all the participants were able to go home with a spiral notebook that had all the slides and all the information to take back and implement into their practices. So it was a good turnout.
Thank you, Caitlin. Okay, and then on the top right, I just want to say kudos to Jenny and Missy. They both put a lot of hard work into these resource guides. We did them for each one of the target counties. A lot of work went into these, and it was much appreciated and much needed for those communities as well. Next slide. Okay, we had another Me Over Meth Region 3 conference. You can see the team. Looks like there was maybe a panel at the top. Is that a panel photo, Caitlin?
Yeah.
And then you have Misty and Ashley, one of our peer specialists, in the bottom photo. Next
and that
slide.
was a great turnout too. And it was very creative. It was different. I mean, there was like art included in the conference. Kim did a wonderful job with this conference. So I just wanted to include that, and thankful that they included us.
Awesome.
Kim is awesome. I just have to say, Kim is awesome because we're going to send her this recording. Her creativity, this conference, and then bringing in the art and music for the prevention conference. I'm just so impressed with her.
Yeah, for sure.
Okay, community event, North Arkansas Reentry Fair. We held this in Harrison. And it was the first time we had done a reentry fair. The goal was to create a coalition for the area, and we have gauged some interest in that and hoping that will be a sustainable effort. There was record sealing at the clinic, a lot of different resources given out, lots of naloxone given out, all the different flyers that you've seen throughout this presentation, most of those were handed out. So it was a really fun opportunity for us to get to connect with that community. Next slide. Okay, this is some more Naloxbox installs. As Caitlin said, we have 9 out of the 10 counties completed. The last one we're working on is Marion County. You can see the Naloxbox locations there in that handy dandy little handout that I believe Caitlin made that. Didn't you? The Naloxbox location? Yes. Yep. And then again, Josh and Ashley have been instrumental in making sure that this gets done and actually being the boots on the ground and getting out into these communities. Next slide. Be There Stigma campaign. I want to sit here for just a second and talk about all the work that Misty did on this. She did an amazing job. This is one of the campaigns that we ran to talk about being there for those that are struggling with substance use disorder. And just being there means so much to these individuals. And we did an Audio Go campaign, and I want to give some stats from that campaign. Some of this stuff doesn't make sense to me because I'm not in marketing, but I think the numbers speak for themselves. We had 106,798 audio impressions and unique users, 60,104, campaign banner clicks, 13, Campaign banner impressions, 7,721. The listen through rate was 98%. So that tells me that this was a catchy thing and people were actually staying and listening to the entire campaign ad. 53% were female, 46 male. The age group that we mostly reached was 35 to 44, which came in at 19.95%. The target counties, so we targeted the 10 counties that we serve, and Harrison was the highest reach at 31%. Behavioral, most were following political parties at 40%. And then the big player and publisher was Pandora. And then you can see the different.
Thank you for sharing those.
I'm sorry, Jenny.
I was sorry. Thank you for sharing those.
Oh, yeah. So here you can see the different billboards that were placed in Eureka Springs, Hinsville, St. Joe, and Harrison. And then we also printed out stickers and mini, what are they called? That goes on your car.
Bumper stickers.
Magnets?
Bumper stickers. Thank you. And we still have more of those that we are handing out as well. So if you're at the Overdose Walk, please come by the table and see us. Next slide. Okay. Caitlin, can you hit on this social determinants of health for me real quick?
Yeah, that was part of a bigger series that we did with Share. And Kim and I just talked about how social determinants of health actually should be considered social determinants of mental health, because there is several risk factors that go into someone's obviously genetic makeup, but also their mental health. And we need to consider that while we are seeing patients in primary care. And we just discussed how you can implement SDOH interventions into your treatment plan so they're more effective.
Awesome. Then there's a few more there. We won't go over each one of those, but we'll be happy for you to go. We'll look on our website at all the monthly webinars and events that are going on. We're actually 3 minutes past the hour, so I'm going to try to wrap it up quick. I do want to highlight two other things. The While You Wait podcast, Caitlin and I were honored to be able to lead that project, and we did 3 different podcast interviews. The first one was with Dory Haddock and Sean McCowan talking about stigma around peer support. Then we had I'm forgetting his name.
Dr. Rogers and then Dr. Manning.
And then Dr. Manning come in and talk about maternal mental health. Hold on one second.
Just to continue, the part 2 for Dr. Schuler that we talked about is right there and also available on the website. And then down on the right, we were in DQuinn again because we love it so much at the Senior Citizen Day, and we were able to hand out Narcan and provided a lot of stigma just in one-on-one conversations with people.
And then last but not least is the peer spotlight videos that we did. We wanted to really highlight peer support in some of these counties that aren't as aware as Central Arkansas of what peer support is. So we had 9 different peers come in and we did interviews. These are still being released. Please go check them out on our Facebook page as well as our YouTube channel. And do y'all think that we want to go ahead and play one of these, or we just want to send people to the link to watch these? Do we have time to do this?
I think I'd probably have them just go and watch on their own time, but that's up to Jenny.
I agree. Okay, so yeah. Please go to our Facebook page or our YouTube channel to watch these. Next slide, please.
Oh, wow. That's it.
We made it.
Yay. And Brittany, thank you for sticking with us.
We know we're a few minutes after, but as you can tell, so many things have been happening. It was really hard to try to keep it all within the regular meeting time. We just want to say thank you. I know most of our partners have had to hop off to other meetings, but we will be reaching out to you in the future. We want this work to continue. we have really been able to highlight and identify the need of educating and addressing substance use disorder, especially in our rural areas, with lack of resources. And so we want you to know this is not goodbye, but we'll look at continuing to work on different projects with you. So thank you all. Have a wonderful weekend, and we'll see you soon.
Thank you.
Bye-bye.